My name is Hatem Soliman. I am a consultant in cardiac intensive care. I work at the Royal Brompton and Harefield hospitals, and I work within the team based mainly at Harefield Hospital. I am from Egypt, Alexandria, and I have been working in this organization for the last 7 years, and I have been very fortunate to initially join the organization as a fellow. I was trained in cardiothoracic intensive care at the Royal Brompton Hospital and in Harefield Hospital, and then I was very fortunate to be part of the consultant team over the last 5 years.
The first question that we'd like to ask you is, when starting out on your career, how did you decide and choose your speciality?
I would go back thinking about where I started. I graduated from Alexandria University and I finished my medical school 2003. And afterwards, there was lots of uncertainty because I wasn't sure which specialty I would pursue. And at the same time, my dad had heart issues, so that really put me towards cardiology. And I was very interested into cardiology until I got opportunity to have critical care training in Alexandria University. And after starting critical care, I loved it. So it was a matter of destiny, and initially I didn't choose critical care, but then it chose me. And after, I would say, the first year of my critical care training, I fell in love with echocardiography and ultrasound, which really ignited my passion for cardiac intensive care. And I was very fortunate that I was supervised and mentored by the best echocardiographers in my country. So they helped me getting the accreditation, and I put this passion of ultrasound into my role as intensive care. And I would say uncertainties are not always bad, because it can open doors that you would never ever imagine they existed.
It's true, it's true. Thank you. So how did you go about gaining more experience when you were starting out? I suppose when you were during medical school and then just afterwards when you were looking for that initial experience?
So, generally, I loved medicine, and I went to medicine with deep passion. And again, this is something bring us back to Harefield. As an Egyptian, my role model has always been Professor Magdi Yaqub, and that's what my dad wanted me to pursue. So initially I wanted medicine, and I persevered, I worked hard. And after finishing medical school and completing my training in critical care, I sought opportunities in learning, and I even moved outside Egypt. Initially went to Dubai, and I worked in a big cardiac center. I performed echocardiography, and I realized that the best way to gain experiences is to try to build your network, because building network and collaboration and meeting people and being active, not only clinically, but also in the fields of education and research, are really game-changing, which really helped me tremendously. Because the more I contributed actively to activities related to education, the more I felt I'm learning, I'm growing. I had a bigger network, and I was also fortunate then, back in this period, that I was starting my activities within the European Society of Cardiology, which I believe was truly important in my career. It's a process that again, full of uncertainty at the beginning, because you wouldn't expect whether you will succeed or you will fail. But hard work, perseverance and faith are very important, and also seeking the right mentors, because that is truly fundamental.
Fantastic, thank you. So what advice then? So what advice would you give yourself when starting out, your younger self? What one piece of advice would you give them?
To younger self. So that's a very important question, Andy. So I think not to be afraid of failure, because when I was young, I was really mortified and scared and anxious about failing, because for us in medicine, we are always used to being the best, succeeding, getting high grades. But in clinical and professional life in general, failure is important. Because what I learned in my career so far, that failure is an important part of the process, and I learned to embrace failure and not to be afraid of it. Because if I remember the times I failed, they tremendously helped me or shape my experiences and bring better perspective and maybe open doors that I never thought they existed.